The Global Health Advocacy Incubator has worked with stakeholders at the federal level, Kano and Lagos states, and some of the key successes were increases in the budgets for NCDC. In fact, more than double between 2021 and 2023. In Kano State, working with stakeholders, for the first time, a budget line was created for epidemic preparedness and response. And in Lagos, a budget line created for public health emergencies. So one of the key successes is getting government at national and subnational levels to increase funding for epidemic preparedness and response. Now, this is very critical because that has really strengthened the capacity of Nigeria to prevent, detect, and also respond to epidemics. But emphasis here being on epidemic preparedness, emphasis being on prevention. The Health Security Accountability Framework was jointly developed by stakeholders. And Global Health Advocacy Incubator worked with Leesdale, to bring together all the stakeholders led by the Nigeria Center for Disease Control. Now, the accountability framework is very critical to help us track how much is requested for, how much is appropriated, how much is released, and how much is spent. And indeed, what these monies are actually, utilized for. And if you can demonstrate that these monies that have been released have been judiciously utilized, and then you're able to also know the gaps, then you can always continuously make the case for increased funding, which you can then use to further strengthen the health security landscape in Nigeria.